Hello and welcome to 15 Minutes with Longevity. My name is Giselle Wertheim-Ames, and in this program we're going to be talking about allergies. My guest in the studio is Dr. Carla Els. She's a pediatric pulmonologist and specialist in allergies from Linksfield Hospital. Welcome to the show, Carla. Now, before we get to talk about allergies, we're just going to join Dr. Lance Maron in his practice to look at the patient experience in terms of allergy and allergy testing.
Cats, dogs, pollen, and nuts. These are just the obvious ones when thinking of all the types of allergies one could get. Dr. Lance Maron from Netcare speaks about the various symptoms associated with allergies.
Well, I think in an ENT practice where you see both children and adults, we mostly get patients who come complaining of allergic rhinitis, where it presents with a blocked stuffy nose, a runny nose, or the typical hay fever type symptoms where they're sneezing, the nose is itching, and this is often associated with allergic conjunctivitis, so that the eyes become itchy and they water, and patients sometimes complain of itchy ears. And it can either be perennial or seasonal. Our perennial patients are the ones that are suffering throughout the year. They've got problems from January through to December, and there's no real change in those symptoms over that period of time. And then you get the seasonal type allergies where the patients will, at a particular time of the year, have a flare-up of their allergic condition.
Unfortunately, these conditions do not differ according to the cause.
Often the symptoms don't differ depending on the type of allergy, and that's what makes establishing what causes allergy so difficult, because all the patients present to us in a very similar fashion, so that whether they come with a blocked nose or a runny nose or itching or sneezing, that doesn't give us a clue as to what's causing the allergy. They're all presenting much the same way.
So how do the specialists pinpoint the cause?
When we approach a patient or a problem with a patient, we always go in a nice chronological fashion. A patient comes to you and you take a history. Okay, and so there are certain things on the history that are going to first give you an idea that you could be dealing with a patient who's suffering with allergies. What's very contributory often is a family history. You definitely find that children who suffer with allergies have parents who have very similar problems. Then we go into the examination of the patient. And there are certain things that become more obvious to you when you examine a patient who's suffering from allergy. What you want to exclude are other causes. So you're going to look for things like infection, because sometimes a patient can present to you with a full-blown sinusitis or an infection that can mimic the signs and symptoms of an allergic rhinitis. So it's very important to establish, are we dealing with an infection and are we dealing with allergy? So once we've treated all the other causes of inflammation that are not allergy and we're left with a patient who continues to suffer, we then start deducing that that patient is suffering from an allergic problem.
Once the allergy mystery has been solved, Dr. Maron says the treatment and medication may become a daily routine. Chronic medication for long-term benefits.
When treating a patient, you're going to follow a nice chronological order and try and find the easiest method of treatment that's going to suit the patient. So that's what's important, is to design the best treatment that suits your patient. Some of our patients' allergies are pretty mild, and as I say, once we've got all other causes of inflammation nicely treated, like infection, we then are going to just try and dampen down the body's general response to whether it's the environment or whatever foods they might be taking, be it milk or wheat or peanut that's causing the allergies. So what we do then is we put them onto a chronic course of medication that usually involves the administration of an intranasal steroid spray, which is used every single day on a long-term basis, and together that's often coupled with oral medications like antihistamines, or we also have some leukotriene antagonist medication, which is used to counteract the effects of the exposure to allergens. And often it's easier to manage it this way than to try and establish exactly what the allergy is. Because if a patient is allergic to many things, then if you manage to dampen down the body's response to the environment or to the foods that they're allergic to, then all they need to take is this medication on a chronic basis. In this instance, it's very important to explain to patients that these medications long-term do not have any serious side effects, and in fact to use them on an ongoing basis and to use them consistently is much more beneficial to the patient, and that will keep their condition under control, and hopefully there'll be far less flare-ups.
As there are multiple causes, symptoms and treatments, decreasing the occurrence of allergy flare-ups seems to be the key to maintaining a healthy and normal life.
So the concept of allergies is always very interesting. I mean, I know a lot of people, you say, I'm allergic to this, I'm allergic to that, but it is actually a serious health problem, isn't it?
No, definitely, and we see the increase. I mean, I see it in my office. Allergies has been around quite a while, but I think the doctors are becoming more aware of it. We're doing more training in our pre-graduate groups, and I think that's why we're also picking up more allergies. Needless to say, people have misconceptions about allergies as well.
So what is an allergy?
Well, basically an allergy is where you have a trigger. Let's say for argument's sake a cat. You get exposed to the cat, makes your nose itch, you sneeze a bit, you rub your nose, and then even later on, about 4 or 5 hours later, you sit with a blocked nose and you have to go to bed, and then you have to like elbow your husband because he's snoring because of the cat allergy, you know. So that's basically something that creates a reaction in your body which gives you a symptom: itchy nose, sneezy nose, and also a blocked nose eventually. Obviously there's different allergies with different symptoms.
Sure, and some allergies you could probably live quite easily with, you know, a little bit of a sniffle or an itch, but if it's perhaps life-threatening or has a much more severe consequence, where would that be on the scale? How do you look at allergies on the scale of their impact on the human system?
Well, to be honest with you, I don't think we can justify that one allergy is less of a problem to one person than another. It's all quality of life issues. And for me, a quality of life issue might be worse than for you. But if you want to classify into levels of severeness, something like a bee allergy is often a very severe condition. You can get anaphylaxis, which means you can have a reaction in your body where you can subsequently die. A peanut allergy. How many people we know has a peanut or get exposed to a peanut and then they pass away because they can't get to medical treatment quick enough?
So in those cases, you first have to find it out, unfortunately, the hard way, through actually consuming or being stung by a bee. It's not something you'll know or can be tested. Can you be tested for something in advance?
Yes, you can. You can be tested for bee allergies and you can be tested for peanut allergies, but the risk you run if you test it before you've actually had a reaction is, well, now I'm not going to have peanut. And have you looked at whatever contains peanut? I mean, I had a little girl who they said that she's allergic to every single peanut. That includes tree nuts. So for 7 years, she didn't have any peanuts, and she actually didn't have tree nut allergies. So I would rather say, you know, if you can test them, do a food challenge, or some of the moms, there was a child last week with me. Mom said she had peanut butter, gave her little girl a kiss on the cheek as she put her down to sleep, and she had a huge rash on her face. So obviously there might be a peanut allergy. Tested her, and she had a peanut allergy.
How do we get allergies? I mean, are we born with them? Do we have a genetic disposition, or, you know, do we develop them in response to the environment?
It's a combination of things, to be honest. Obviously, we're still finding out. It's still the tip of the iceberg, but genetics does play a role. If you have a family member, a direct family member, mom or dad, who has allergies, you have about between 50 and 60% chance of inheriting that same allergy as such. So in my family, I've got my dad's genetics, so I'm allergic.
What are you allergic to? You've got to own up.
I'm allergic to Hast's mites. I had, when I was younger, I had injections to take it away.
And how does that present, for example?
I had a lot of sneezing, itchy nose, and a lot of ear problems. Also a lot of sinusitis, chronic sinusitis. So Dr. Marin will probably be the one to consult in those cases. And yes, I lived at the ENTs when I was younger. So, but at the moment I'm quite controlled, and that's the whole crux behind it. You know, if you manage it well, you conscientious and committed, no reason you can't.
So let's talk about the management, the natural and the more scientific or the allopathic intervention.
Yeah, you're asking the wrong person about natural.
Okay.
No,
let's just talk about how we can manage it. Yeah. What are all the options open to a person with an allergy?
I always tell the parents, you know, as long as you don't do harm to the child and as long as it's helping, doesn't matter what you do then, But unfortunately, if we look at westernized medicine and natural medicine, we have a lot of literature for westernized medicine and very little for natural medicine, and that's our problem. Okay, so once we've got more studies, maybe we'll get into the natural line of treating far often and far better. So in my opinion, natural is, if you can avoid it, then you avoid it and you're rid of your allergies. So for instance, if it's a peanut allergy, if you can avoid a peanut allergy, it doesn't bother you as such. Okay. But otherwise, if you look at the natural or the Western management as such, you first have to avoid the
if you can. But for example, pollen, you can't.
No,
it's a good example. That's
you'll have to put them in a bubble. No,
yeah.
And we can't. So quite frankly, but let's say it's a cat. So I'm very fond of my cat. I'm not going to get rid of my cat necessarily, so I'll have to get rid of myself. But we say that if it's a really detrimental effect the cat has on the child, you'll have to get rid of your cat as such. Okay, so get rid of the cat, episode number 1. Secondly, if you do have exposure to a cat and a family member, take an antihistamine. Okay. Thirdly, you have to treat if it's nasal symptoms and there's what we call allergic rhinitis, so that's a constant clear runny nose the kids get, or what we call the allergic salute. This is another one. Okay, so they often say, no, I don't have any allergies, doctor, and then the mom and dad sits there in the office, and you're like, yeah, you do. So that's often something, or you get the child on the shoulder. The mom has a little mucus stripe on the shoulder because they rub their noses. It's a nice way to scratch it. So there's often tips like that you can do, and so there's numerous symptoms.
Okay. Now, I met a very interesting biologist when I was in Korea recently at a conference, and he was telling me he was quite worried. He's a microbiologist. He was quite worried about kids becoming, the parents are very fussy over hygiene issues. Don't allow the kids to play in sandpits. Got the soap out all the time and scrubbing, and he said that he felt the body has to develop a natural response to the environment.
I agree.
So you agree with
Definitely.
that? And so what is your advice again? I mean, parents, because I think it starts when you're young. If you have the right building blocks, we know with health, it serves you. What would your advice be, again, around this issue and how we approach allergies and the formation of them over time in a more proactive way?
Well, there's a lot of literature on prevention of allergies, and that's pre-conception, whilst the mom's pregnant, and early life with feeding and breastfeeding. So needless to say, that's a whole talk on its own. But definitely move away from this hygiene thing where everything has to be sterile. Go, let them play in the mud. I think it's more exposure, the better the kids will do. It's a fine line. I mean, you're not going to let the kid run in the road and lick the tar road, but if the dummy falls on the floor, by all means, rinse it off, don't sterilize it as such. But and the other problem is, often in our social day and age, the kids are put into a daycare or in a creche because the mom needs them to be looked after. And the early exposure of viruses also increases the risk for allergies. So if you can, wait if it's possible.
Great. Thank you for joining us in the studio. Well, that's a wrap. Thank you very much for joining us. Next week, we'll be talking to Dr. Ridwan Mir. He's the plastic surgeon who pioneered a skin transplant operation on the young burn victim, Pepe Kruger. We'll be discussing the medical breakthrough in this plastic surgery and scarring with him. So stay well, be healthy, and I hope to see you here next week for your dose of health news.